Hello, I'm Dr. Liz Plowman. I'm a physical therapist, and I'm the owner of Pain Boss Physical Therapy, a 100% telehealth physical therapy practice specializing in the treatment of orthopedic and chronic pain conditions. Today, I would like to talk to my fellow physical therapy providers about professionalism in the telehealth setting. Professionalism is something that we do in the clinic or any practice setting that we're in. It's something that's very important. We want to look professional, dress professionally, conduct ourselves in a manner with our patients, and communicate in a effective, open, and professional way. All of these rules absolutely still apply, but there's a couple of things we need to think about in the telehealth setting that are a little bit different. First things first, dress professionally. Even though many of us may be seeing patients in the comfort of our own homes, we still need to look like we are in the clinic. We still need to dress like we have gone to work for the day. If you'll notice, I'm wearing a polo shirt. I have slacks on. In a lot of online meetings and video chats, people are only generally concerned with what you can see from the waist up, so they may be wearing sweatpants, flip-flops, etc. But in the physical therapy setting, you may very well need to back away from your camera to demonstrate a movement or an exercise for the patient, and the patient will see you from head to toe. So you need to look professional from head to toe. The second thing to think about is what is in your camera view. Just as you would not take a patient into a cluttered, dirty exam room or a cluttered, dirty gym environment, you need to pay attention to what is on the screen that the patient sees, because that effectively is your office, that is your clinic. So if you look around, you obviously don't need a studio. This is my home office. I have plenty of room to move around. It looks reasonably professional. It's got a bookshelf and all the supplies that I need here. You want to make sure that your space is contained, it is private. Not only is that a professional issue, that is a patient privacy issue. You do not want family members, etc., coming into your patient examinations. It doesn't look good, and it violates the patient's right to privacy. You also want to pay attention to your camera angle. So if you are using a laptop, as many of us do, they're wonderful, they're portable, but if you're using a laptop, you want to prop your laptop up on a couple of books or a box. The reason for that is if you are looking down at your laptop, that means the camera angle is up. And so that will look something like this, right? And so your patient is then staring at your ceiling or ceiling fan, and it just doesn't look as good. So prop your laptop up. That way you are looking at your camera on a more level angle, and that creates a more realistic professional experience. You also want to consider lighting in your space. Now, if you've taken any sort of photography courses, you know that you want to have lighting behind and lighting in front. What this is going to do is create a good image on your screen. You don't need to invest in any sort of professional studio lighting. Lighting that you have in your home will work well. You just need to be strategic on how you position it. So in my particular case, I have a really strong, good overhead working light that's providing me light from the back and from the top. And then I also have a small desk lamp here that's providing some soft incandescent light. And then I use what's called a ring light. Certainly not required by any means. I do this a lot, so I like to have a good professional look. I'm going to show you what that ring light looks like. So you're going to actually see my lighting change because I'm going to turn it off. All right. So a little bit of a difference there, but you notice how the screen did get darker. I don't have as much lighting in front of my face. This is what a ring light looks like. I got this on Amazon for about $30, $35. And it positions right over the camera, or if you have a certain setup, you can actually put the camera in the light. Point being that it provides some nice soft lighting coming at you right around your camera. So I'm going to set that back there. Again, like I said, it's not required, but it just provides a little bit of extra attention to what you look like on screen. And there it is, turned back on. Point being, though, you want to be careful about your lighting. You want to preview your video before you actually engage in a telehealth session with your patient. Make sure it looks good. You don't want to look washed out, too much light. You also don't want to look completely dark like you're in the witness protection program. So just preview that. Sound is another one. Most computers come with a built-in microphone, and they are of much better quality than they used to be years ago. Most computers have adequate sound for your sessions, but if you do want to step up your game a little bit, you can invest in an external microphone. This is the one that I choose to use. It sits on my desk. It looks kind of retro, so it makes me happy. But the important thing is that it has a noise canceling feature to it, so it doesn't pick up a lot of the background static. It gives you a better sound quality for your patient. Not required, but anything we can do to step up that professional image is a plus. Another option is a headset. They make several, 2 ears, 1 ear. This is the one that I personally prefer to use. Clips on the ear, just like this. And then this piece here is a microphone. But it also has noise canceling capability just to provide a better quality sound for my patient. If you are in an environment where people perhaps could hear you in your own home, a headset is actually a really good tool to help protect patient privacy. You want to minimize distractions, just as we would in the face-to-face clinic environment. You don't want people coming in and out of your room. You want to focus that time one-on-one with the patient. So that applies in our setting as well. Just some things to think about. Most computers have some sort of a do not disturb setting. That will help to silence any sort of notifications, dings, beeps, etc. that may happen on your computer if you get an email or an alert. You want to silence your phone as well. Don't want to be checking your phone. Anything you can do to minimize those distractions. We want to maintain that good professional image, even though we are in a telehealth video environment, and that is part of how we do that. Family pets. I have 2 dogs who love to be in everything. Patients will forgive a lot. If a puppy comes on the screen once, the patient may say, "Oh, that's cute," the first time. But if it's repetitive, that becomes a problem, and that's a distraction that is taking your attention away from your patient, and that is not professional. So if you have a family pet who happens to be a glutton for attention, you may want to find them accommodation for the time that you are in that telehealth setting. Eye contact. So eye contact is tricky since you're not actually face-to-face with your client. I have been in too many Zoom meetings or video chats where the person talking to me is talking to me like this, and they're looking down at the corner of the screen. And it gets the job done, but it's just weird. It's not natural. It's not part of that normal communication experience that we're trying to replicate as best as possible. What happens when the person's looking down like this is that your chat window or your video window is actually down in the corner of their screen. So they are looking at you, but they're looking at where you are on their screen, which is down here. So what I do, my tip or trick to simulate eye contact as best as possible, is I will actually take my patient's image, the window that has their image in it, and I will move it up so that it is right underneath the camera on my computer. That way, I'm looking as close to that camera as possible, which is what is going to simulate eye contact and make this a more natural conversation experience. Last thing is be prepared for the session. Whether it's an evaluation or a treatment session, have all the supplies that you anticipate you might need handy. So, for example, if you intend to demonstrate the use of a back support, have that lumbar roll or back support handy so that you do not have to pause the video, leave the frame, etc. Just as in the clinic, you try to minimize the times you have to leave the patient alone in the room to go get something. The same thing applies here. If you want to demonstrate an exercise with a resistance band, I would recommend having them handy. Have that resistance band handy. You look more prepared. You look like you have anticipated their needs, which you have. And it minimizes those distractions, minimizes that pause. I hope this has been helpful. We just want to maintain our professionalism as physical therapy providers, no matter what setting we're in, whether we're in the clinic face-to-face, whether we're in telehealth. We are still professionals, and we still need to be professional. Thank you so much.